everyone, and welcome. Thank you for joining us tonight for another topic in the VMC Animal Health Education series. We're grateful to have you all in attendance tonight, and on behalf of our team, I would like to welcome you to tonight's presentation titled The Remarkable Athletic Capacity of the Horse. My name is Scott Horsfall, and I partner with clients and clinicians at the Piper Equine Hospital, as well as our ambulatory clinic, West Metro Equine Practice. Both are part of the Veterinary Medical Center in the College of Veterinary Medicine, where every day we serve animals of all shapes and sizes and their families. The VMC Animal Health Education series features our leading experts covering a variety of topics in veterinary medicine that provide relevant health information that will provide for a better life and well-being for animals and people. The VMC Animal Health Education series features our leading experts covering a variety of topics in veterinary medicine, ranging from relevant health information for your beloved pets to ways that we're advancing clinical research that will serve animals and people for generations to come. During the presentation, you can use the Q&A function in Zoom to ask questions. We also ask for pre-submitted questions, and we'll do our best to cover the themes that came up most frequently during the final portion of the program. Please note that if your question for tonight relates to your pet's specific medical care, it is best to call the VMC directly or have your veterinarian contact our team for consultation so that we can best serve your family. Now, I'd like to introduce our speaker for tonight, Dr. Anna Firshman. Dr. Firshman is a specialist in the large animal internal medicine and is a charter member of the American College of Sports Medicine and Rehabilitation. She works with all large animal species and is particularly interested in medical causes for poor performance in horses with muscle diseases, neurologic conditions, and heart disorders. We're grateful and appreciative to have Dr. Firshman of the Piper Equine Hospital medicine team to join us tonight. And with that, I'll hand it over to Dr. Firshman.
Well, hello, everyone. Just want to check that everyone can see my slide and me, I guess. Is that working, Scott?
Perfectly.
Okay. I see a note in the question and answer from Diane saying we can't hear you, but hopefully that's not the case anymore. All right. Well, unless anyone else puts a note in the Q&A, I'll assume everyone can hear me, and welcome to tonight's presentation. And thank you so much for joining us here tonight. And like Scott said, the topic of tonight is the remarkable athletic capacity of the horse. And now I'm a medicine person, so I'll be focusing on a lot of the medicine type stuff here tonight. And I thought maybe before we sort of delve into this topic, some of you might notice I have a bit of an accent. I don't consider it an accent, but apparently it is one. And so I just wanted to just let you know a little bit about my background and sort of who I am, I suppose. So basically, I qualified as a veterinarian from the UK at Liverpool University in 1999. So Liverpool's around about here for those of you that aren't familiar with the Beatles. And I grew up in the southeast of the UK. And shortly after qualifying from veterinary school, I came over to the University of Minnesota just for a year to do an internship, and kind of got sucked in a little bit to life here in Minnesota, and stayed on for a large animal medicine residency, and also pursued PhD training in equine muscle disease. So at that point, I wasn't going home anytime soon, and I stayed, and I joined the faculty at Oregon State University for a few years, and then returned to the University of Minnesota in 2009. I've been here ever since. So I teach and do clinical medicine in the equine, in the Piper Equine Hospital. And so I teach veterinary students and also take care of our equine patients. And in addition, I also treat other large animal species like alpacas here, and pigs and sheep, goats, cows, that sort of thing. And so my interest is certainly internal medicine in general, but I certainly have specific interests in sports medicine as it relates to internal medicine. We're talking about heart and lung related things here tonight, and also have some interest in rehabilitation and acupuncture. That's sort of my background, in case you guys wanted to get to know me a little bit. And outside of work, these are some pictures from a little while ago. I was putting these together and realized that, you know, I did do a fair amount of eventing. I'd say in my younger years, I'm probably old enough to say that now. These days I do more trail riding, riding for pleasure. I have my 2 horses at home with me, and my various other animals that I spend my time with, including my other half, who seems to get on pretty well with the horses too, which is lucky. So again, you know, this year, I guess, is an Olympic year, although we're sort of off cycle. So I thought it might be appropriate to start off with a couple of factoids, which I always find kind of interesting and makes me sort of happy to be working with horses the way I do. But you know, like I say, it's an Olympic year. Japan this year was meant to happen last year, obviously. But if you think about it, you know, think about the Olympics, the horse really is the only animal other than the human animal. I guess we call humans animals here at the vet school. But horses are the only animals to compete at the Olympics, if you think about it. I guess there was some pigeon racing back in the 1900s, but that's one thing to lay claim, I guess. And then if you also think about it, equestrian sports in the Olympics and other sports, like other areas where they're carried out, are the only sport where men and women compete equally. So again, something to be said there. And then also equestrians are some of the oldest Olympians, which sometimes people might think, well, you know, what does that say? But I think it says that it's a discipline that really lasts through the ages, and, you know, from young to old, we get to enjoy our horses. So I think the oldest equestrian Olympian was 73, a dressage rider, and recently Nick Skelton, a UK show jumper, won gold medal for the UK back in Brazil, and he was, I believe he was 59. So not necessarily what we're talking about, but it's sports and it's athlete related, so I thought I would begin there. So just to start off the presentation, certainly, you know, horses, there's no doubt they are elite athletes. They are developed and evolved to do some of the most amazing feats. Certainly we have heavy breeds that are bred for, you know, our draft work mainly, obviously sort of in the before machines sort of took over, you know, field work on farms and that sort of thing, and they're capable of pulling weights greater than 1,000 kilograms, usually just for short distances because of the exertion that requires. And then our lighter breeds of horses are bred more for speed and endurance. So we have our thoroughbred race horses. They run, you know, between 800, 5,000 meters up to speeds of about 44 miles per hour. And then we have our quarter horses reaching speeds so much faster than thoroughbreds, but for shorter distances, so up to about 55 miles per hour. And our standardbred horses, obviously, these are trotting or pacing still at fairly high speeds for set distances. And then at a slightly different end of the spectrum, we have our Arabian endurance horses that are more developed to trot at generally slower speeds, but for very long distances, anywhere from 20 up to 100 or even more miles, sometimes over a day, sometimes more extended than that. Your average speed of an Arabian endurance horse used to be about 6 to 9 miles per hour. These days, some have been clocked in at sort of 22 miles per hour for these sort of lengths of distance. That's pretty incredible. And then obviously our warm bloods, can't forget the warm bloods in terms of their abilities for dressage, jumping, the sort of maneuvers that they're capable of doing. So obviously, you know, lots of different breeds are used in different areas, but certainly certain breeds seem to be more sort of akin to certain sports than others. I forgot to flick through my pictures right here for you, but you get the idea. So, you know, certainly thanks for those of you that filled in that survey yesterday that we sent out. It was great to get an idea of what the audience is. It seems like we have a wide range of horse riders, a lot of trail riding and pleasure riding, certainly some dressage disciplines and some hunting and some of the Western disciplines as well. But certainly it seems as though from the audience, the majority of people have at least ridden a horse at some point, and many of us own multiple horses. So a great mix of people here tonight. So the outline for this talk is to sort of describe how horses are remarkable athletes, but in particular with regards to their cardiovascular and their respiratory systems, and they're sort of two systems that I get excited about because I like medicine. So hopefully you'll stay with me here and be as excited as me. I want to talk a little bit about the effect of exercise on those systems, and also the effect that training can have, and also sort of mention some of the problems that can occur and what we can do to diagnose and treat them. So I realize it's 6 p.m. and putting up graphs at this time of night might not have been the best idea, but I really couldn't get away from the topic of this talk without sort of talking first of all about oxygen and oxygen uptake, and just sort of showing this graph. And it's just a very important concept for athletes in general, any species really. So when we're talking about athleticism, oftentimes we're talking about effort, and oxygen uptake is really the gold standard measure of effort in any sport. And basically this graph right here sort of shows how oxygen uptake changes with effort. So generally we talk about increasing effort sort of correlating with increasing speed. So this is a horse that pertains particularly to a graph that pertains particularly to a horse where, at the speed of about 2 to 6 meters per second, we might be trotting between 6 and 8. We're sort of doing a slow canter, and then up to the 14 to 16 meters per second. That's kind of your full or racehorse galloping speed. And it's really quite interesting in that this side here is oxygen uptake by the body. And as speed or effort increases, that oxygen uptake increases, but it really happens in a very straight line, linear kind of fashion, which is kind of incredible when you think it's, this biologic system that's sort of developed this way. It's happened to just kind of form this nice straight line on a graph. But really what's happening, oxygen is gradually increasing in the amount that the body needs to produce energy to be able to make its muscles contract and run faster and faster. But there's a certain point where the body just can't take up any more oxygen anymore. It can't breathe any harder, its heart can't beat any faster, and its muscles just won't work any harder. And that's where this sort of plateaus off and becomes level. And this is what's termed as VO2 max. So any of you that potentially, do your own sort of athletic activities, you sort of, you know about VO2 max, but this is basically what it refers to. Now in horses, that VO2 max in a generally fit thoroughbred is going to be about 150, sometimes even getting up close to 200 mils per kilogram per minute. And that's a pretty high level of oxygen uptake in comparison to a lot of other species. A sedentary female or even male that doesn't do much exercise might be sort of in the 20s or 30s. A fit male might be 60, 70. I think the highest human VO2 max recorded was roughly about 93, and that was Bjorn Daly. I used to have a picture of Lance Armstrong here, but obviously that changed in recent years in terms of knowing how he produced his VO2 max. But VO2 max can be increased. There's a certain part that you're sort of born with, genetics and that sort of innate ability, and then training will increase that. I won't sort of do any more about the oxygen uptake because it's not very practical and useful every day, but it's important as a baseline for talking about this subject. So, we talk about effort and exercise and how that sort of goes together, but there's certainly a lot of different factors that affect how hard horses are able to work during exercise. And I noticed a lot of questions that came in, with the sign up that sort of talked about, can you provide a set format for training my horse? And I think this slide right here really sort of explains how difficult it is to come up with something that's prescriptive or kind of cookbook for a horse, because every horse is going to be different. And I think personally that's really where trainers really come into kind of what they provide us, with their experience and years of training horses. Because myself as a veterinarian, I deal with illness and disease and trying to keep horses healthy, but certainly I haven't spent my time training horses and getting them fit as part of my sort of everyday job. But there are lots of factors that will affect how hard a horse is going to work, and that needs to be taken into account when developing an exercise program. So certainly age is important. We know as any sort of animal, human gets older, there are sort of more difficulties in maintaining fitness and getting fit and that sort of thing. Sex can certainly play a part in terms of gelding, mare, stallion, that sort of thing. Breed, certainly there are certain breeds that will sort of maintain and achieve fitness somewhat easier than others. Sort of the classic example would be your thoroughbred racehorse, because that's kind of what they're bred to do. Body conditions, so obviously a horse that's overweight and maybe is carrying a little bit too much fat is going to have a harder time getting fit than a horse that's in good muscle. And that baseline fitness in the first place is going to affect things. That innate ability comes down to genetics, conformation, things like that. And then whether there's any underlying health conditions that might be affecting, you know, if there's maybe some low-grade heaves or asthma going on, then that's going to affect how hard a horse can breathe without having trouble. And then on top of that, all the horse factors that will affect how hard a horse can work during exercise, there's a whole bunch of environmental factors as well. So, you know, the exercise, the type of exercise that's being done, what discipline, you know, is the horse is being asked to do, how hard it's being asked to work. Certainly the rider can have a major effect in how hard a horse has to work. You know, obviously a heavier a rider is, the harder it is, you know, it's kind of more weight to carry in addition to the horse going as well. And then the technique and ability of the rider will have a part to play as well in terms of that horse balancing that as well. Certainly the going, so you know, in racehorse industry, that's a huge factor in terms of how well certain horses will be able to work. Some horses prefer wetter ground over dry, but it can certainly change the effort that needs to be put into place. And then certainly climate. We deal with that here in all sort of extremes, don't we? In Minnesota, you know, we have our hot, humid days where we'll sort of worry about the horses getting overheated and they won't be able to work as hard. But also there's very cold temperatures that can create some issues as well in ability to sort of exercise as well. You know, roundabout now is about perfect, isn't it? So our horses, their natural athletic ability, a lot of that comes down to the really high rate of oxygen they're able to take up and use. And there's lots of different reasons for that. Certainly there's a good place for that oxygen to go. They have very large amounts of muscle for their body weight. So about half of their body weight is muscle. In thoroughbreds, it can be even slightly more than half of their body weight. And are fit thoroughbreds off the racetrack that are very well muscled. But then they also have very large lungs that allow them to breathe in oxygen and sort of get it to where it needs to go, and also very large hearts in comparison to their body size. And I'll get into that in a little bit more detail. And then there's some other things that are a little bit, not necessarily unique, but certainly happen in horses and maybe not in every species. So the spleen harbors a whole lot of red cells that aren't necessarily in the bloodstream. And when a horse is exercising and the adrenaline's going, that spleen can actually contract and squeeze out even more red cells into the circulation. And those red cells are what's needed to transport oxygen to the muscles to make energy for contraction. So that spleen has a very important ability to sort of increase the amount of work a horse can do when it needs to. And then within the red cells, the hemoglobin is that protein that carries oxygen to get it to muscles so that they can contract and do the work. And horses will have a very high hemoglobin concentration in comparison to other animals as well. So not only do they have sort of very large adaptations like large lung size, even down to the proteins sort of within the cells are sort of adapted to produce that natural athletic ability that they have. So a little bit of terminology and sort of background to go through before we sort of talk about how the heart responds. So the heart rate, most people know that this is the number of beats per minute. You know, the baseline for a horse is usually about 40 beats per minute. And then there's a couple of other things that are worth just kind of explaining before we get into how the heart responds to exercise. So the stroke volume, now that's the amount of blood that is pumped by the heart in one contraction. It's the amount of blood that the heart squeezes out in one beat. And then the cardiac output is the amount of blood that's pumped by the heart in 1 minute. So basically the cardiac output is sort of a function of the stroke volume and the heart rate. So, you know, sort of the number of times the heart beats times the amount of blood that's squeezed out per beat. And then just as a little bit of a review, because I'm not entirely sure kind of how much background people have, but just to kind of run through this in a basic way, we have blood that runs through vessels within the lung that picks up oxygen from the airways, and then that gets brought back to the heart into the left side. And then when the heart contracts, that pumps the blood with oxygen in it to the rest of the body. The body sort of takes up that oxygen, and then the blood flows back into the right side of the heart, and then that right side of the heart will pump and send that blood back to the lungs where it can pick up more oxygen again. So that's kind of the basic way that that cycle works. So the cardiac output is basically the principal reason for oxygen uptake. And like I said, it's the amount of blood that's pumped by the heart each minute. And in the horse at rest, that's about 30 to 45 liters. And that's roughly the amount that it takes to fill up a car tank with gas. So if you think about standing at Fleet Farm, filling up your tank, you know, I don't know that I've ever sort of just filled up my tank in 1 minute. It usually takes maybe, you know, a little bit longer, 3 to 5 minutes, but, you know, that's how much is expressed in 1 minute in a horse. And then during exercise, that'll increase to about 240 liters per minute. So we're basically filling up 5 cars worth in the space of a minute. And in very fit racehorses, this is even more. So just an incredible volume of blood that is able to be pumped by the heart in that space of time. Another thing that's pretty incredible about horses, and just what contributes probably to their athleticism, is heart size. Now, this is a little bit controversial. Don't know if we have any Australians in the audience, but Australians really believe very strongly in heart size. Jury's out a little bit on this side of the waters, but certainly heart size does contribute to the ability to pump that blood. So, you know, the heart is sort of this big muscle, and, you know, the bigger your muscles are, the stronger they are. So if you have a big heart, it's able to pump much more strongly and release more blood into the circulation and sort of circulate that blood. So horses that perform exhaustive sports like racing and endurance and eventing often have bigger hearts than horses that don't do those types of sports. An average horse heart mass is about 0.9 to 1% of its body mass, and racehorses generally have proportionally larger hearts. So in trained racehorses, it's usually a little bit more than that, sort of 1.1. But in our elite racehorses, it's generally been found that those hearts are much, much bigger, almost double the size in some cases. There's a bit of a story behind heart size in racehorses, where sort of the general folklore is that Secretariat, obviously a very great racehorse, had the largest heart ever measured. But what I actually understand is that the pathologist that did the post-mortem examination actually did not weigh his heart, unfortunately. And so the next week he had another racehorse called Farlap, who he measured, and then he sort of guesstimated the size of Secretariat's heart. But that's I believe the right story. So the effects of training on the heart. Now, this is certainly not something that's just specific to horses. In humans, we certainly know that training does change the way the heart, you know, heart size and things like that, dependent on the type of exercise that's done. But in general, training, most of the studies that are done in horses, we're looking at kind of racehorse training in terms of the effects on the heart. And it's been shown that it'll increase the heart mass. It'll also increase the volume of the heart chamber. And so that combination of things allows for a greater stroke volume, because it can contract more and sort of squeeze more blood from the heart and create more cardiac output. So if you remember, I sort of showed you that graph with oxygen uptake and how that changes with speed. And like I said, it's not necessarily a very practical way of measuring effort, because, you know, you need fairly expensive lab equipment, and it's not very practical for a regular horse to be sort of hooked up to masts and things when they're exercising. And so certainly there are other indicators of effort that are used, and the main one is heart rate. And heart rate also has a pretty interesting sort of straight line relationship between speed or effort and the way that the heart rate increases with that effort. And so we actually do this as a lab with the veterinary students, and we'll put a heart rate monitor on a horse, and we'll put them train them to the treadmill, increase the speed, and you'll see the heart rate go up in this straight line fashion. It's quite interesting. But the same thing will happen. We don't take our labs, our lab horses up to these sorts of speeds, but the same thing will happen where there's a certain point where the heart just literally can't beat any harder. If you think about here, it's sort of 200 beats per minute. This is about 3 to 4 beats a second. So you can just imagine a horse's heart beating nice and slowly at 40 beats per minute. And then, when it's going this fast, how fast that heart must be beating to beat 3 to 4 beats per second. So basically, it'll increase linearly up to a point where things start to level off and where the heart just isn't capable of beating any faster. And this is what's called heart rate max. So in racehorses, this is usually sort of in the 220, maybe up to 250 sort of range. Most horses, their heart rate max is going to be about 200 or so. So how do we measure heart rate though? What is actually going to be possible to do in our horses? Certainly, there are things that we can do that are quite easy and low cost when the horse is just standing still, but aren't very practical for us when we're trying to ride them. Palpating a pulse, they have a nice artery under the jaw here. That's certainly fairly simple, but pretty difficult during exercise. I would definitely fall off if I tried to do that. You can also listen with a stethoscope, but certainly counting anything sort of over 100 beats per minute for me is pretty difficult. I certainly sort of bow down to the small animal vets that do that on a regular basis with their smaller animals and cats and that sort of thing, but it is pretty difficult to count 100 beats per minute or higher. And again, it's pretty impractical during exercise. Now, some people might say, well, I could just listen very quickly when the horse comes to a stop, but you'll find out as we go through this that the heart rate comes down very, very quickly, within a few seconds of stopping exercise. So that's not really giving you a good idea of what the heart is doing under exercise. So then we have electronic monitoring, which 10, 20 years ago was a fairly expensive thing and wasn't really used anywhere other than in research labs. But now we have much more affordable equipment that certainly some horse owners and horse trainers will use as a measure of getting their horses fit, just as part of a training program. Certainly they're fairly reliable. We have kind of just general sort of heart rate monitors that can go around the horse's girth. They transmit a heart rate to a watch that you can hold, that you can strap to your wrist. You can ride horses on top of these things. And then we have even more sort of, I guess, fancy equipment where, where we can measure heart rate, but also get an EKG at the same time in a wireless fashion, so that we can exercise the horse and do an exercising EKG at the same time. Some of these units also have GPS involved as well, and so that way you can get kind of distance travel and get an idea of speed at the same time as well, which can be useful depending on what you're trying to train for. So the resting heart rate. As I mentioned, it's between about 30 and 40 beats per minute. It is well known usually that athletic horses have very low resting heart rates. Now, a lot of people I find sort of tend to confuse this with humans, where we know that when humans, the more fit that they get, the resting heart rate will actually go down. Now, this is something that actually doesn't happen with horses. An athletic horse will have a low heart rate, but if that athletic horse wasn't fit anymore, it would still have the same low heart rate. So unlike humans, it's not a measure of fitness. It means that the horse probably has a very good potential to be fit if it was trained enough, but we can't use it as a measure of fitness, unfortunately. So I used to be very proud of the fact that my thoroughbred mare had a resting heart rate of 26 until I realized this, and then realized that, yes, she had the potential to be a very fit athlete, but maybe wasn't at the time. So heart rate at different speeds. So resting 30 to 40 beats per minute, like I mentioned, that correlates to about 2 liters of oxygen used each minute. And then when a horse goes into a trot, that heart rate is going to actually increase quite a bit straight away to about 70 or 102, up to 110 beats per minute, usually about sort of 20 liters of oxygen used each minute at the trot. And then when a horse is in a full gallop, the oxygen amount used is about 75 liters at that point, and the heart rate often will be greater than 200 beats per minute when they're going full out like this. So that maximal heart rate that I talked about is a little bit different to the highest heart rate reached at different sports. So I thought it might be useful to just kind of show you what average highest heart rates reached are with different disciplines. So a horse that's maybe trotting around the arena doing some light schooling work, usually the heart rate's going to be in a sort of 120, maybe 140 sort of range. Trail riding or some endurance riding where they're maybe sort of stretching out at a trot, 140 beats per minute. And then sort of moving up into the more sort of exhaustive and exertional type sports, the cross-country horses doing in sort of the cross-country phase of eventing, heart rates are usually measured at about 170 to 180 or so. If there's a steeplechase portion, usually that's even more exertional, so the heart rate's going to be a bit higher in that situation. Jumping horses are interesting in that when they've measured heart rates with horses that are going around a jumping course, they'll actually go down to the sort of 120, 140 range as they're cantering or trotting between a jump. But then as they actually sort of push off over a jump, the heart rate will shoot up into the 200 range, as that's sort of a large amount of exertion all at once. And then our racing thoroughbreds going at the maximal speed, this is sort of considered the most maximal exertion that a horse is able to do. Usually the heart rates are sort of 220 or more. So pretty incredible increases from just a 40 baseline. Now the heart rate max, if you remember that graph where it plateaus, that is actually individual to each horse. So each horse has its own heart rate max. And the maximum heart rate, like I say, can range from 210 to 280. So that's certainly not the maximum heart rate that's going to be achieved at each of those disciplines. It's just an individual horse, like if you actually ran it as hard as it possibly could go, how high could its heart rate actually get? Now, I'm not saying that we should do that, and I'll explain why in the next slide, but I just wanted to explain the concept. So basically, in addition to similar sort of this VO2 max principle, horses that have the highest heart rate maxes, or the horses that can beat their hearts the fastest, generally tend to be the better athletes, because they're able to do more work at a specific heart rate that's lower than heart rate max, basically. Similar to that baseline heart rate, that increase in fitness is not going to alter that horse's heart rate max. It's just going to be able to travel faster or work harder at a given heart rate as it gets fitter. The other thing about heart rate max is that just like humans, it does decrease with age. So if those of you that they go to the gym, you see those heart rate graphs, of the heart rate that you're supposed to be aiming for in certain age groups. And as you get older, the heart rate that you aim for is a little bit lower. That's because that heart rate max is decreasing with age. So something to sort of bear in mind with some of us that have older horses that we're trying to keep fit. So like I said, I wanted to mention about heart rate max, and it's a concept that is sort of important to understand, but it's certainly not somewhere that we're trying to get horses to at any frequent stage. And really the only time that it generally tends to happen are horses that are either training for race training, or maybe horses that are at very high level cross country or something like that. And the reason for that is that this point right here is the absolute maximum the animal can be working. And so it's a pretty dangerous zone in terms of the animal fatiguing and potentially injuring itself. So it's something that we really don't use as a major part of conditioning program in terms of getting them up to that maximal heart rate for the sake of the animal. So what do we use instead? So there's these concepts called V140 or V170, V200, depending on what discipline you're involved in, that can be used for training. And basically what they are the speed that the animal can go at a heart rate of 140 or 170 or 200. And basically you can use them as an indicator of fitness, because as that horse gets fitter, the V70 should increase. So it'll be able to go faster at a lower heart rate, so to speak. So as the horse gets fitter, this graph moves to the right, But if it's sick or, maybe not having a good day for whatever reason, it'll actually move to the left and the V170 will decrease. And that can be a good sort of warning indicator that maybe, the horse is having issues for one reason or another. Maybe there's a lameness and there's a pain involved or something like that. And then when exercise stops, so obviously the heart rate will go down. And like I mentioned, it runs down very, very quickly. There's a rapid deceleration. And that first minute is when it really has that quickest reduction, which is why listening with a stethoscope doesn't help us very much. But in general, most horses, the heart rate should be less than 100 at about 4 to 5 minutes. That would indicate that the horse wasn't overworked, was fit enough for what it was just asked to do. The rate of decline is going to depend on a few things, and certainly we'll use it as a measure of fitness. If you do a particular exercise test, the same speed or distance, and you see that the rate of decline of the heart rate is actually quicker than it maybe was the last time you did that test, then that might indicate that there was an improvement in fitness. But obviously there's going to be environmental conditions that play into that. So if it's a very hot and humid day, then the heart rate is going to stay higher for longer as the horse sort of dissipates that heat. And then cardiac problems. So luckily, these are generally rare. These are not conditions that we see the most common in the hospital or out in practice, thank goodness. The main problems that we do see are either problems with the heart rhythm, so arrhythmias, things like atrial fibrillation, for example, or problems that maybe result in a leaky valve, which could result in a murmur. So the thing with cardiac problems, however, is that, sometimes they can present with just some mild poor performance. The horse just isn't sort of doing as well as it's expected, but sometimes the effects can be more serious and can actually even sometimes lead to the horse collapsing under exercise. And obviously that's bad enough for the horse, but obviously if there's a rider on top too, that can be even more catastrophic. So heart problems generally are going to require more of a specialist evaluation. They're usually picked up on out in the field by the veterinary practitioner, but for further workup, they tend to require more of a specialist involved, like a veterinary cardiologist or something like that. And so we'll do echocardiography quite commonly in horses here, where we can look with ultrasound at all the different valves and the blood flow through the heart and do all sorts of measurements to evaluate the heart function. And we'll also do ECG analysis, either just standing or also with an exercise component. So a lot of heart conditions, part of the assessment is actually doing an exercise ECG to see if there's any abnormal rhythms that will happen while the animal is being exercised, because that can be the sort of risky part for, potentially collapse under exercise. So we have these units that we're able to put sort of under the saddle, and we can get exercising tracings and then evaluate those and look for any abnormal rhythm in horses that potentially need it. And then certainly, depending on the condition, there are treatments that can be done with some of the arrhythmias. They can be converted similar to the way humans might be converted, and sort of other treatments for depending on what the issue is. All right, so that's sort of what I wanted to cover a little bit with the heart system. And now I just wanted to move into the respiratory system, but obviously sort of, as I sort of explained, they're very intimately sort of tied together. The one thing that, just to start off with, obviously the respiratory system is used to take up oxygen and then release carbon dioxide that's made in the muscles out into the air, so it doesn't build up. But it's also very important for heat dissipation in horses. Whenever they're exercising, they certainly are building up heat. So a good respiratory system is important for releasing that heat so that the body doesn't get overheated. And also it's used for balancing acid-based sort of issues as well. Now horses are a little bit unusual. This cut section through here sort of shows the head and the airways of the horse. And obviously they're breathing air through their nostrils, it goes through these chambers within the nostrils, back into the back of the throat here, and then down through the larynx, which is right here, and into the windpipe or trachea. This part of the respiratory system is called the upper respiratory tract, And then the lower respiratory tract is what is basically the lungs and the bronchi that feed into the lungs. Now, as I was saying, horses are a little unusual compared to some of our other species in that they are what's termed as obligate nasal breathers, meaning that they can only breathe through their nose. They're not actually capable of breathing air in through their mouths, which is obviously a little bit different. So if you think about how we breathe, we have the option to use both, the same with dogs, and even ruminants will be able to breathe both ways. So it becomes a little bit of a problem if there's any sort of obstruction in the nasal cavities or even in the larynx in terms of getting that airflow through and down into the windpipe. So like I say, airflow is important. We all know that. We need airflow to be able to breathe. And really any resistance to airflow is going to increase the amount of energy that's required, and that's going to limit the ability of that horse to do the exercise that you're asking it to do. The resistance typically happens at the parts that narrow down quickest. So in the horse, that's actually the nostrils, and then also the larynx, which is what this picture shows right here. So this area back here is the back of the horse's throat. So basically, we have this structure called the larynx. For those of you that haven't seen a scope before, these things right here are called the arytenoids. And when the horse is exercising, these will be stretched out to sort of open up this airway. This black sort of diamond shape right here is the opening into the windpipe. This structure right here is called the epiglottis. It looks a bit like a tongue, but it's much smaller. And when the animal is eating and it swallows, this thing will flap up over the top of the entrance to the windpipe so that the food is swallowed into the food pipe or the esophagus, so that it doesn't go down into the windpipe and create an aspiration. So like I say, the greatest resistance to airflow when the horse is exercising are going to be either at the nostrils or the larynx. And so there's a few things that the horse will do during exercise to try and reduce that. And we've all seen horses with their nostrils flaring, sometimes not under exercise if they're just a little bit stressed for whatever reason, but that will increase or decrease the resistance to the airflow. And then the larynx will also dilate. So these arytenoids here will stretch out close to the sides and open up that airway. And then in race horses and other sort of really exertional activities, you'll see the horse really stretch out and straighten that head and neck to try and limit sort of any resistance to airflow. So this picture again, but just wanted to tie it in with the respiratory aspect of things. So at rest, the respiratory rate of the number of breaths per minute, usually around 12 to 16 breaths per minute. And that sort of relates or is equivalent to about breathing in and out a quantity of about 50 liters per minute. When the horse then trots, that's going to increase. The respiratory rate will depend on what the horse sort of decides, but it can increase to about 500 liters a minute of airflow going back and forth. And mainly at these slower speeds, that's done by increasing the respiratory rate. And then at the full gallop, that amount of respiratory or gases that go back and forth will increase to about 1,500 liters per minute. And they do that both by increasing the respiratory rate, but also increasing that depth of breathing. So they're going to be breathing deeper into their lungs. So wanted to bring this part up because this is a pretty interesting feature of horses, but we also do see it with other animals that sort of run on four legs, and actually even humans do a little bit of this sort of coupling between their stride and the way that they breathe. So basically with horses, during a fast canter and gallop, a horse is going to take one breath with every stride. In the trot and the walk, they'll breathe kind of as it sort of suits them. Sometimes they'll get into a bit of a rhythm, but they can adjust their breathing depending on what they want to do. But once they get into a canter and a gallop, they're basically obliged to breathe out as their legs hit the ground and breathe in as they go into that suspension phase. So when you hear a horse sort of galloping past you, maybe at the track, you'll hear this, and that's them breathing out with every time their legs hit the ground. So they're breathing in that in-between size. And so generally that's what we're listening for if we're sort of thinking about roarers and problems with the upper airway. What we want to hear is absolutely no sound in that period of suspension. You shouldn't hear any noise in that time. And the idea behind this, or I mean, who knows? I guess we can't ask the person that decided this, but basically the thought is that it minimizes the work of breathing. There's a whole lot of pressure that happens from the abdominal organs on the diaphragm and the lungs when the feet hit the ground and everything kind of shoves forward. And it's thought that it's easier to breathe out in that moment and then breathe in when everything sort of rocks back a bit. So that's kind of the principle behind it. The thing with us, with our sports horses and things, and just sort of think about this is, especially if we're doing things like eventing, racing, some of these more higher intensity sports, is that this breathing and stride sort of coupling really influences each other. So the breathing certainly will influence the stride length, but also the stride length will influence breathing. So anything that causes the stride length to shorten, such as maybe just a mild lameness, will give the horse less time to breathe in and out, and then they're not able to get as much airflow. So that can be a really important thing for horses that, you might be winning a race by just half a length or something like that. If they have a shorter stride length, then they may not win that race. So I talked a bit about how training affects the cardiac system. As far as the respiratory system, it's a little bit different. So basically, we know that when horses are trained, you can get some improved strength to the upper airway muscles. So the larynx and the area in the throat might get a little bit stronger, but there's actually very little effect on the lower respiratory tract in terms of training, which is kind of interesting. Part of it is because they have such an amazing capacity to start with when they're healthy, but it doesn't change that much with training and exercise. So this is quite different compared to the marked changes that we see in the heart and the muscles and ligaments and tendons and that sort of thing. And they sort of talk about this being a limiting factor to the potential of horses in terms of being able to go faster or that sort of thing. So when exercise stops, the respiratory rate obviously decreases. There's a little bit of a different two sort of types of respiration that happen in this situation. Typically, the horse is going to take a couple of deep breaths, maybe a few, and then the respiratory rate settles into sort of a 60 to 100 breaths per minute until this thing called oxygen debt is repaid. When a horse has had a really exertional activity, it's exercised to the point where it's just not getting enough oxygen to its muscles, and so it goes into this sort of anaerobic process, and so it'll breathe deeply until that oxygen debt is repaid and the muscles sort of have everything sort of back in balance. And after that is over, then the respiratory response really depends on the body temperature. And so at that point, especially if it's a hot, humid day, or you have a horse that maybe was asked to work really hard and got kind of overheated, then you'll see the breathing change a little bit. It still might be quite rapid, but it'll be more shallow. And that's what's known as panting. So if you're evaluating the respiratory recovery, then you want to observe both the rate and the depth of respiration in these horses. So as far as respiratory problems, certainly we see respiratory problems more commonly than we do heart problems, which is probably, we don't like to see any problems, but it'd probably be better to have a respiratory problem than a heart problem in most cases. And probably, it's actually a fairly common presentation for poor performance, is finding that the animal has a low-grade respiratory problem that wasn't obvious as a respiratory problem before the workup happened. If it's a problem that's associated with the upper airway, we might also find that we recognize some noise in that cantering stride, like I talked about, in that suspension period where it should be quiet. And if it's a problem with the lower airway, so down in the lungs, then we might also see signs of coughing or maybe some nasal discharge. So if we're talking about the upper airway, one of the main ways that we'll evaluate those issues is by doing a scope. And what we're looking for are problems that are associated with the larynx, sort of talked about here. This is actually a picture of a normal larynx, like I showed earlier, with that epiglottis that flips up and covers over that windpipe. And then there are numerous abnormalities or disorders of the larynx that can happen in horses that will affect their ability to breathe and perform, or sort of cause them to make noise in the show ring, which can be difficult for being successful in the show ring and that sort of thing. Some of the most common ones are left laryngeal hemiplegia, which is also called roaring. And this is where the left arytenoid cartilage right here is actually paralyzed. You can see here it's nice and symmetrical and both are sort of moved out to the side equally. This one is kind of covering over and collapsing into the airway. And you can just kind of imagine that that's, it's constricting the amount of air that can get down into the lungs. There are other abnormalities, and these aren't all of them that can happen, but certainly endoscopy is a very useful technique. This one here is called epiglottic entrapment, where a piece of tissue kind of covers over the epiglottis and it's not able to move very well, and it sort of causes changes to airflow and sort of gurgling and trouble breathing. And then this is called dorsal displacement of the soft palate, where you can see the epiglottis is actually missing in this image right here. What's happened is it's kind of got itself caught underneath this shelf of tissue, which is called the soft palate. And again, these horses might have trouble sort of getting air properly into the windpipe just because the airflow is disrupted. So like I say, these can be evaluated by standing endoscopy, but sometimes things are not very obvious as these images might show. And we actually want to see what the larynx is looking like under exercise. And so we are able to actually do scopes while the horses are exercising as well. And I'll show you some footage from those. And for a number of these, there are surgical options to help with these horses' problems. So dynamic endoscopy is a newer technique that we have for horses. Not aware actually of other species that use this so much, but we see a wide variety of laryngeal problems that really need to be evaluated under exercise. And we have this piece of equipment here in the hospital, thanks to some of our donors. And they basically have it's an endoscopy unit that goes up, and you can see it kind of places up into the throat here with a connection on the saddle pad here, and then it transmits to a wireless monitor so we can actually monitor the function of the larynx while the animal's moving. This is one of our horses here with it in place. And they really seem to take to it pretty well. We've had horses that come in and had this equipment used. Owners have come in and even ridden them, or we can lunge the horses if riding is not really warranted. So I wanted to show you some footage from what this would look like. I find it quite interesting myself. It's probably been around now about 10 to 15 years. So this is more of a normal endoscopy of a horse exercising. And again, a little bit more difficult to evaluate than the still shots, but you certainly see a lot more. And you can see these arytenoids get stretched out to the sides during exercise to open up that windpipe. This is the epiglottis right here. So you can see all the motion that happens when the horse is exercising, but he has a nice airflow down into the lungs here. And this one is a little bit different in that I think maybe you can see that this left arytenoid is moving quite a bit in comparison to the way this horse reacted. And so as the horse got more tired, this actually started to move over even more. You can kind of see how that airway is almost halved in size, and that's going to create quite a lot of resistance to flow and obviously difficulty breathing for this horse. So then there are some surgical procedures to try and help with these situations. And then just quickly, there's some lower airway conditions. Probably the most common that we see are equine asthma or heaves, and then the bleeder condition, where horses that are undergoing very exertional type exercises will actually have some bleeding into their lungs. We also see infections from viruses and bacteria as well that we often have to work up. And that most of these lower airway type conditions involve more of the internal medicine team, where we're sort of evaluating the lungs, doing radiographs and ultrasound. We might want to collect samples from the lungs to get a more clear diagnosis. And then once we have our diagnosis, making various recommendations, maybe to the environment or exercise type management, depending on what the condition is. And then there's various treatments, again, depending on what the underlying cause is, but we have equine inhalers for equine asthma now, so we'll just like with humans, we'll have inhalers for them and other types of treatments, again, depending on what the condition is. So overall, just want to sort of conclude here. Hopefully that wasn't too heavy for an evening discussion, but hopefully you find this subject as fascinating as I do. Overall, hopefully everyone agrees a horse has amazing athletic capability. A lot of that comes down to that superior oxygen transport capability that they have. They have really exceptional heart and lung function, and certainly training can help improve heart function, but quite honestly, horses start out even as unfit horses with really quite incredible heart and lung functions to start with. And the respiratory system certainly has considerable ability to start with, but doesn't improve much with training. But overall, a well-performing horse requires healthy function of both systems. Just a nod to Prince Philip here, given his last couple of weeks. So overall, just want to say thank you. Thank you for staying with us tonight. Hopefully you found the topic interesting. Thank you certainly to our wonderful clients and obviously our donors who trust us with their four-legged companions, and certainly whose your support is very important to help us continue to care for horses in Minnesota and also to train our future horse veterinarians as well.
Thank you so much, Dr. Firshman, for your wonderful presentation and your insights tonight. With that, are you ready to jump into some of the audience questions?
Yeah, and I'm sorry I didn't leave a lot of time, did I?
Yeah,
you guys have a lot to say.
Okay, we got some good time, so thank you. The first question that we have is, how does breed or body type affect the kind of athletic ability of the horse?
Shall I stop sharing my screen with that?
You can leave it up, it's fine.
Yeah, okay. Yeah. How does breed and body type? Let me see. So, sorry, I just make sure we on the same page here. So, breed and body type affecting athletic ability in horses. I mean, absolutely. Different horses are bred for different sports, and absolutely it can. It's a whole topic on its own, but obviously, a draft horse, you wouldn't necessarily choose to run in a sprint race. You wouldn't necessarily choose a thoroughbred to sort of pull heavy machinery behind for plowing a field. So certainly that body type is going to have a huge effect. It certainly goes down even to individual muscles. There are certain breeds that are bred for endurance that are going to have muscle fibers that are specific for endurance type activities versus a draft horse that has muscle fibers particularly for strength and short bursts of energy. So I guess without sort of losing too much time, I would say certainly genetics certainly play a part. I also think that there's a huge amount of sort of that psychology of athleticism that's is very difficult for us to study in animals. Certainly gets a lot of attention in humans, but you have that heart for wanting to do that exercise, and that's somewhat of maybe an individual, but maybe some genetic component there too.
Thank you. It sounds like it may be a topic for another presentation too. So the next question that we have is, how much exercise does a horse need for a healthy cardiovascular and respiratory system? And how slowly should you kind of work up to that goal?
Well, I guess I certainly didn't cover that point in the talk, because I think that question is kind of a tricky one to answer. Maybe the question is more like, how much, what is the, what are you trying to get the horse fit for, I suppose. So, you might have a horse that you want to use for trail riding, maybe endurance and that sort of thing. You want them to be fit enough for that exercise, but you wouldn't necessarily want a horse to be as fit as a racehorse for, to be a trail horse. You'll get yourself into problems with behaviors and all sorts of things, and the difficulties that come there. So I think it's not really, there isn't really a prescriptive number or fit enough. I think one thing that's pretty, at least gives me comfort, is in knowing how much athletic capability they have even to start with. And so if you're not necessarily very fit yourself, probably the horse is going to be fitter than you. And so working together to build up that stamina, I certainly think that that is reasonable, depending on kind of where you're starting out with. You can certainly use heart rate monitoring and things like that, knowing kind of what heart rates you should expect at certain speeds, you know, and use that to kind of monitor and see that they're getting fitter. If you want a horse to get fitter, there's always a need to increase the amount that you're asking a horse to do, but it has to be done in a very gradual fashion so that you can be aware of any changes that might be happening that are detrimental as well. I'm not sure if that necessarily answers the question. I mean, certainly there are phases of training, so classic phases of training that are utilized by some disciplines. They sort of call them like phase 1, phase 2, phase 3 is used very much in the racehorse industry, but also some of the other areas like eventing and things like that, where, you know, you have this foundation phase where you're building up aerobic capacity, and that can last, you know, anywhere from 14 to 20 weeks in a racehorse, and that's kind of building up that basic general aerobic fitness, lots of trotting, maybe a little bit of slow cantering, building up strength in the tissues and that sort of thing. A lot of times that phase is probably enough for baseline type, you know, trail riding and that sort of thing. But certainly the more you do of that, the horse will certainly get fitter beyond that too, if they're capable.
Kind of similar to that question, or maybe in addition to, do you believe in giving, or do you feel that it's important to give a horse a few weeks off every year for training of rest?
Yeah, and these questions are very much sort of questions that I certainly would refer to a trainer for, quite honestly. You know, they are the experts in this. I think that there's a certain amount of art, but also science that goes into training, and a lot of experience and years of experience that go in there. So, you know, there are certainly lots of people around with lots of different viewpoints, but certainly, particularly, I mean, we know in the human area as well, we know that rest is a good thing for athletes. And it depends how much rest, depending on kind of what sport we're talking about. It might be, rest might be just kind of slowing down and doing less of a workout for a while, that sort of thing. But in general, that sort of concept of periodization, where you sort of plan out your year based on kind of, if you have some sort of bigger competitions, you kind of plan your training regime to sort of peak at those competitions and then have a period of rest afterwards. Makes a lot of sense. I mean, that rest period allows for injuries that you may not necessarily realize are there to sort of heal, for tissues to regenerate and things like that. And even just mentally gives the horse some time to just sort of chill and relax and sort of take some time to sort of enjoy the roses, I suppose. So yeah, I do agree. I think in Minnesota, again, depending on the discipline that people are riding in, but in our sort of climate sort of forces a little bit of a rest period, particularly over the winter anyway, depending on kind of what we're doing, because of just the different climatic conditions that we have to deal with.
None of us want to go out when it's 30 below zero. I think based on time, we can do one more question. So I'm going to read this one as it was presented to us. So this person says, curious at what age is it still safe to ride my horse for shorter than 25-mile endurance rides and trail riding? He's going to be 22 in June and is in an incredible shape with no signs of slowing down, but they want to be cautious. That's great. That's great to hear that that horse is doing so well. I assume with you using him for endurance riding, he's probably an Arab, and certainly we hear of a lot of Arabians going on well into their 20s and even 30s and doing great work and still getting ridden and doing lots of exercise. You know, it certainly is, you know, certain horses do seem to live longer and maybe live better in their older years, and certainly the Arabian breed is one of those. I guess for me, this is sort of something that an older professor said to me once, was that age is not a disease. Certainly there are things that happen with age that come along, you know, with use of tissues and other diseases that we see more commonly in old age, but age itself isn't a disease. So if the horse is doing well, you know, you certainly can keep going, but obviously
you need to listen to the horse and notice if they're having a bit of a harder time with the exercise that they're being asked to do, and knowing that fitness is harder to maintain as you get older, and that like things like heart rate max will decrease and things like that. We know that we have to slow down a little bit. But then there's also that, you don't use it, you lose it. So certainly there are a lot of horses that are retired, and then very quickly we start to see them decline. And sometimes you do wonder if them not being moved around as much can sometimes contribute a little bit to that decline. And we see that in people too. So I think it's a balance overall, I guess I would say.
Perfect. Thank you so much for answering some of the questions. We'd like to say a special thank you to Dr. Firshman for her time, presentation, and insights this evening. And thank you to our many participants that shared thoughtful questions in advance and during the presentation. As always, the Piper Equine Hospital is here for you 24/7, and our West Metro Ambulatory Clinic, which is located in Long Lake, Minnesota, is also available for the care of your horse. So please don't hesitate to reach out. Next month, the VMC Animal Health Education Series will welcome Dr. Christopher Stouthammer, who will present on avoiding the scalpel, where he will discuss catheter-based treatment options for heart disease. If you enjoyed the learning and information provided tonight, we encourage you to visit our website at www.equine.umn.edu, or feel free to reach out to us directly. And lastly, we hope you'll consider financially supporting our equine program for the ongoing clinical service, education of the next generation of equine practitioners, or towards the advancement of equine research. Thank you again for attending tonight, and we hope to see you next month. Thank you.